But say if somebody, we talked about waters breaking, like if someone was like, oh, you know, there is a lot of pressure on the cervix in the third trimester, but they're like, oh, I think I peed my pants or my waters broke. And, you know, starting to think, well, you know, yes, in some cases, small amount of cases, that can happen a bit earlier. But what colour would we expect the water to be?
Look, generally the most common report would be either pink or clear, but it can be quite variable. There are some colours that we're concerned about.
Yes.
So I guess with ruptured membranes, probably the first thing is that sometimes it's like the movies and there is a big gush everywhere and it's very obvious, but sometimes it's not. And so if you're experiencing a continued trickle of fluid, you know, if you put a pad on and it's continuing to come out, then that would make us more concerned for ruptured membranes. And if in doubt, again, just get checked by your care provider and they'll be able to assess things for you. But most commonly, the fluid is of sort of a straw colour or a clear colour or a pink colour, and they're all normal variations, and that's fine. The ones that we worry about a little bit more, if the fluid is green or brown, that might be an indication that the baby has past meconium in utero, so might be a sign of the baby being concerned, fetal distress, and so we do like to check those situations more closely and more quickly, and continue to monitor those babies during the labour as well. Obviously, if it's bright red like blood, then we would be concerned about bleeding from either the cervix or the placenta, and so again that would be a reason we would come in sooner than later and we can check things over. But generally speaking, if you think you may have broken your waters, we do encourage you to phone the hospital, and the advice will be to come in for a check and assess the situation, and depending on the situation, it may be appropriate for you to go back home and wait for things to happen, or it may be more appropriate for the labour to be started, but at least that way we can assess things and give you some advice and know what's going on.
Because we obviously don't want those waters to be broken for days on end. You know, we're kind of on a bit of a timeline as well, so we like to, you know, make sure the baby's happy and see some progress from that point forward. But you know, that pressure on the cervix sometimes does release quite a lot of vaginal mucus, which is quite watery, and so in some cases it might not have been that your waters broke, but either way we would like to kind of assess that.
If in doubt, we just would like to check.
You're not being a bother. But obviously green or red are things that, you know, we kind of don't want you to have a good old think about for, you know, 4 or 5 hours. We'd like to have some insight into what's happening, but the pink and the clear or the straw colour are all very normal. And yes, it's rarely like the movies with that torrent of fluid, because that head's normally sitting quite low and acting like a plug.
Exactly.
So there's fluid with the body, but that will come out when the baby's born.